Vital signs: a person's temperature, pulse, respiration, blood pressure, and pain. As you watch the skills demonstrated here in this module, these measurements are the indicator of body function and reflects the status of person's health. So change in vital signs may indicate change in health. Assessing vital signs is an integral part of nursing, and doing it right is an important to make sure you have an accurate data for patient plan of care. As a nurse, it's your responsibility to measure accurate vital signs measurement and report it immediately if you find any abnormal readings. Assessing vital signs in right way every time is a crucial for good nursing care in any study.
Vital signs trolley contain patient file for proper identification and documentation, hand rub to perform hand hygiene, towel or tissue paper to wipe armpit of the client, digital thermometer to check temperature, wristwatch with a second-hand needle to count pulse and respiratory rate, sphygmomanometer to check blood pressure of the client, stethoscope to auscultate blood pressure, pulse oximeter to check oxygen saturation of the client, alcohol swab to disinfect thermometer and stethoscope, kidney trace for waste segregation. Now let's go to patient's bedside. Hello, good morning ma'am.
Good morning, sister.
My name is Caroline TJ. I'm your nurse today.
Okay, sister.
Ma'am, how are you? How was your last night? Did you sleep well?
I am fine. Last night I didn't get sleep because I had severe back pain. After taking pain medications only I slept.
Ma'am, if I give you a pain score of 10, how would you rate your pain then?
At present 0, no pain at all.
Do you feel any chest discomfort or breathing difficulty?
No.
Okay, ma'am, would you please tell me the date and time of today?
Today is 26th December 2018 at 10 a.m.
Okay, now I am going to check your vital signs that includes temperature, pulse, respiration, blood pressure and pain.
Okay, sister.
Ma'am, please show me your ID tag.
Okay.
Okay, ma'am, please tell me your full name.
I'm Anjali Biju.
Okay, Anjali Biju. UHID number is 1818 1818 1171. 1171. Okay, that's fine. This one to wipe your armpit.
Wipe the thermometer with alcohol swab from bulb to stem. Switch it on and wait till low reading appears. Place the thermometer in the armpit with hand crossed towards the opposite shoulder. Palpate and count the pulse by placing 3 fingers slightly over the radial artery. Count for 1 minute, rate, rhythm and volume. Keeping the arm across the chest, observe the chest movement while supposedly taking radial pulse. Count the respiratory rate for 1 minute and observe the depth, rhythm and pattern of respiration. Remove the thermometer once the beep sound is heard. Wipe the thermometer with alcohol swab from stem to bulb and replace to the patient bedside. For assessing O2 saturation, select proximal extremity. Remove nail polish if present. Switch on pulse probe and place the sensor perpendicular to the nail bud. Ensure that the waveform in the pulse oximeter fluctuates with each pulsation. For assessing the blood pressure, position the bed. The elbow should be slightly fixed with the palm of the hand facing up and the forearm supported at heart level. Expose the upper arm. Place the sphygmomanometer at the heart level. Place the lower border of the cuff approximately 2 to 3 fingers above the antecubital space. Wrap the deflated cuff around the upper arm. Perform a preliminary palpatory determination of systolic pressure by palpating the radial artery. Clean the stethoscope with alcohol swab. Proper positioning of stethoscope earpiece in the ear. Check the amplifier of the stethoscope. Palpate the brachial artery with 3 fingers. Place the bell of the amplifier of the stethoscope over the brachial pulse. Pump the cuff until you no longer feel the brachial pulse. Auscultate the client's blood pressure. Pump the cuff until the sphygmomanometer reads 30 mm of Hg above the point where the brachial pulse disappeared. Release the valve of the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm of Hg per second.
Ma'am, your vital signs are normal. If you need any assistance, you press here. I'll be here.
Okay, sister.
Okay, you don't worry. We all are with you. Okay?
Thank you, sister.
Okay, you're welcome.